السلام عليكم أبنائي الطلبة الأعزاء. Our lecture today is about the lipid metabolism disorder. One of the common lipid metabolism disorders called metabolic syndrome. What we mean by the metabolic syndrome? Metabolic syndrome is not a disease, but rather a cluster of disorder of your body metabolism, including high blood pressure, high insulin level, excess body weight, and abnormal cholesterol level. Each of these disorders is by itself a risk factor for other diseases. In combination, however, these disorders dramatically boost the chances of developing potentially life-threatening illnesses such as diabetes, heart disease, or stroke, CVA. This slide, as you see, shows the sign and symptom associated with metabolic syndrome. First of all, there is a central obesity, apple-shaped like obesity. Patients with metabolic syndrome also have high blood pressure, high level of triglyceride, and low level of high density lipoprotein cholesterol and insulin resistant. Regarding risk factor of metabolic syndrome, there are several risk factors that predispose to metabolic syndrome. First of all, age. The prevalence of metabolic syndrome increases with age, affecting less than 10% of people in their 20s and 40% of people in their 60s. Race. Metabolic syndrome is generally more common among blacks and Mexican Americans in comparison with Caucasian people. Another risk factor, obesity. A body mass index, BMI, is greater than 25 inches will increase your risk of metabolic syndrome, and abdominal obesity increase the risk of metabolic syndrome. What we mean by abdominal obesity, that means the patient have an apple shape rather than a pear shape. Another risk factor is the positive family history of type 2 diabetes mellitus or gestational diabetes. This will increase the incidence or prevalence of developing metabolic syndrome. Other diseases, patient with hypertension, cardiovascular disease, and polycystic ovarian syndrome, all of these patients with this disease might develop metabolic syndrome. By which mechanism we can diagnose an individual or a person with metabolic syndrome? According to the National Cholesterol Education Program, NCEP, the presence of 3 or more of the following traits indicates metabolic syndrome. First of all, patient or person with waist circumference greater than 35 inches in women and 40 inches in men. And patient should have high level of triglycerides, so the level of 150 mg per deciliter is regarded as a criteria of metabolic syndrome. Regarding the blood pressure, patient with metabolic syndrome should have blood pressure of over 130 or 140 over 85 millimeter of mercury or higher. And there is controversy about the value of blood pressure. Every textbook says its own. Regarding fasting blood glucose, the patient with metabolic syndrome should have level of 110 and more of blood glucose. While patient the last criteria of metabolic syndrome, any patient with low high density lipoprotein to be more specific and precise. The patient with metabolic syndrome should have lower than 50 milligram per deciliter in women and lower than 40 milligram per deciliter for men. What are the diseases can lead or can predispose by metabolic syndrome? Any patient with metabolic syndrome can develop one of the several following diseases. First of all, diabetes mellitus, cardiovascular disease, including coronary artery disease, MI, myocardial infarction, atrial fibrillation, congestive heart failure, cancer. Several types of cancer can be occur with patient with metabolic syndrome, such as colorectal, liver cancer, breast cancer, pancreatic and endometrial cancer. Neurological diseases. Patient with metabolic syndrome can cause stroke, Alzheimer, and depression. All of these diseases will increase the death rate or cause mortality. This figure, as you see, shows the outcome of patient with metabolic syndrome and ultimately will lead to morbidity and increased rate of death. There is a controversy about the mechanism by which the metabolic syndrome is developed. As you see, there is a theory or a hypothesis say that step by step, when there is a plentiful and easily accessible mixed diet in the context of modern technology and circadian synchronize lead to excessive caloric intake relative to caloric expenditure, lead to a traffic jam at the mitochondria, which in turn lead to increased oxidative damage and inflammation, which in turn leads to insulin resistance, and finally insulin resistance lead to further oxidative fuel imbalance. In this slide, talk about the environmental factors that affect body weight and result in metabolic syndrome. As you know, the sleep pattern, we should sleep at night and work at daytime. So any disturbances in the sleep pattern, this will lead to disturbances in human body metabolism. So total sleep deprivation in rats, this will increase the food intake, but weight loss, heat loss, and death. While in human, sleep restriction will decrease leptin and increase ghrelin, which both of them are hormones associated or responsible for regulation of eating. This in turn will increase the hunger. That means will increase the diet intake every day. Ultimately, will lead to obesity. Epidemiology: short sleep associated with higher body mass index. When we say epidemiology, that's the documented speech by textbook. That means short sleep will be associated with a higher body mass index. Regarding second environmental factors, light. In animals, physiologically dependent upon stable light-dark cycles, while in human, light, even a brief exposure, will suppresses melatonin, which is the alarm for the biological clock and has a role in reducing low-density lipoprotein and blood pressure within 2 months. About the treatment of metabolic syndrome. you have to know the primary goal of treatment is to prevent development of type 2 diabetes mellitus and development of heart attack and development of stroke. So to reduce insulin resistance in overweight and obese individual, the preferred method is an aggressive regime of self-care strategies focusing on diet and exercise. That's clear and documented. It is common for routine monitor the following to ensure that lifestyle modifications are working. You have to notice your weight, blood glucose, cholesterol, and blood pressure every day, or even every week, or every month. Regarding the self-care, to start with lose weight. Losing as little as 5 to 10% of body weight can reduce insulin level and high blood pressure, thus reducing risk of diabetes mellitus, which is a risk factor of developing metabolic syndrome. Exercise. Walking just about 20 to 30 minutes a day or engaging in other aerobic activities can help prevent the serious diseases associated with metabolic syndrome. Cutting off smoking. So stop smoking. As you know, smoking cigarettes increase insulin resistance and worsen health consequences associated with metabolic syndrome. And eating fiber-rich foods, whole grains, beans, fruits, and vegetables are high in dietary fiber. These are important food to eat since dietary fiber is known to lower insulin level. What about the medical treatment of patients with metabolic syndrome? It is routinely used nowadays daily aspirin by patients with hypertension and diabetes mellitus. So aspirin is often prescribed to help reduce the risk for heart attack, which this is play an important role to prevent the process of atherosclerosis. There are some medication to lower blood pressure. Major type of medication used to control high blood pressure include diuretics, angiotensin converting enzyme inhibitors, calcium channel blockers, and beta blockers, and etc. Another medication used to regulate the cholesterol level in our body. These medications such as niacin, statins, and thiopurate can help improving cholesterol in the following ways. A. By reducing the level of low-density lipoprotein cholesterol, which is bad cholesterol, and B. By increasing the level of high-density lipoprotein, which is good cholesterol, and C. By decreasing the level of triglyceride, which is another bad component of cholesterol. Other medical treatment by using weight loss drugs, which is rarely indicated, but in specific and special circumstances, along with diet and exercise, it may be necessary to prescribe weight loss drugs. And lastly, some physicians prescribe insulin sensitizer in individuals with diabetes, often prescribe metformin, which is glucophage XR, to decrease insulin resistance. These medications may also be useful in improving insulin metabolism in individuals with metabolic syndrome. Thank you for listening. You have to read this lecture, and you have to Google the subject in the net, and you have to broaden your knowledge about lipid metabolism disorder. Thank you very much and see you later.